I'm going to move very quickly into our state IT landscape today, and I don't think any of this will surprise you in terms of what the states have been dealing with in terms of their fiscal situation. We have most of the states in a very, very slow fiscal recovery. We've just seen some new data that, for again, the majority of the states' revenues are exceeding projections and their forecast, but we're still in tough times. We still have budget reductions and mid-year budget cuts going on in about half the states. The CIOs have been pressured both at the enterprise level and at the agency level to really look for operational cost savings, and that what we've seen from that is certainly the opportunity for lots of change and innovation, drive toward consolidation and other operational cost reductions, and I'll talk about that in a moment. With that change and opportunity certainly comes the challenges of continuing to maintain the enterprise environment and in terms of the legacy. And the legacy systems today probably comprise almost 50% of the total portfolio. And in some of the areas we're going to talk about today, we're talking about, again, legacy systems in terms of things like Medicaid, claims processing, and other areas that are very important to our citizens. And certainly IT security, we've had more aggressive activities in that area. That's something we have focused on here at NASCIO for the last decade, is improving our information security posture and reducing the risk to state government. And with all that going on, if that wasn't enough, we have the challenges around the IT workforce, and about 30% across the board of the states are reporting about 30% of their IT employees are eligible for retirement. So we have this potential retirement tsunami coming up. Many of those folks have held back during this recessionary period, but we may see a lot of those folks making the decision to leave. And at the same time, the states have a very difficult time recruiting in terms of the younger workforce and the skill sets they need. And again, we've done work in that area and have seen some significant skill set gaps, particularly in the area of IT security, project management, and architecture, difficult skills for states to attract when competing with the private sector. And then finally, something that certainly the association here we've had to face, but also one which causes certainly disruptions in the continuity and stability of state programs, and that is the state CIO transitions. And that, is right now about 25. So we've got 25 new state CIOs, and out of the 27 new governors that were elected in 2010 and took office in 2011. So again, 25 new state CIOs as we talk today. One of the things that we did in the summer of 2011 was a survey of both these new state CIOs and the existing state CIOs. And certainly feel free to go to the NASCIO website or Tech America or Grant Thornton. We did this in partnership with Tech America, our association representing the technology vendor community, and Grant Thornton on our second state CIO survey. The C4 agenda. The C4 refers to consolidation, collaboration, clout, and change. Feel free to download the entire survey results from our website, but I'm going to spend a few minutes talking about a couple of the items. And one was clear that we asked several questions around healthcare, and healthcare received a lot of attention in the survey. We asked a series of questions around the involvement of the state CIO in health information exchanges and collaboration with other states, and also whether their architecture and their information infrastructure was ready for some of the demands of the health information requirements coming out of the federal government with the reform, with the Affordable Care Act. And certainly we've seen that that's going to be a challenge for many states. So again, if you're interested in the results of that, certainly go to our website and download that full report. But healthcare, again, is an area that we focused on. And just last week, we released our 2012 priorities, and I invite you to look at our top 10 list. This is something we've been doing for almost a decade, where we do a forced kind of ballot for all of our CIOs at our each annual conference, and we ask them to list their priorities, and then we take a homogenized view of that by ranking those into a top 10. And we've highlighted a couple of areas that had been on the list for a number of years and continue to receive attention, and it's kind of the intersection of our webinar today, and that is healthcare and health IT, the insurance exchanges, assessments going on, the partnering and the collaboration, and that's all under the healthcare rubric. And then combine that with security, again, around risk assessment, around the security frameworks, data protection, third-party issues. These are things we've also addressed in other surveys, and certainly part of that would be identity and access management. And again, that's under that general topic of security. So these are the priorities that are around what I'll call strategic initiatives or programs. So they're fairly high level. And from 2011, they haven't changed that much. The two new ones are in the 9 and 10 spot for 2012, and that's portal and mobile services and mobility. I would, I guess, make a broad assumption here in looking at all these topics 1 through 10 that areas around healthcare are going to demand that all of these topics receive attention. We're talking about budget and cost control. There's governance around our health exchanges. There's certainly discussion and opportunities around using cloud platforms and cloud computing services, particularly in a regional mode for addressing some of our health exchange needs, particularly in the health insurance exchanges. Required security of the data. We require connectivity, particularly for areas like telehealth and remote diagnostics. Those things are going to need the broadband capabilities that our nation deserves in terms of that particular priority. And shared services and portal are certainly ones that, again, resonate with folks in the healthcare community, because we're all talking about having portal services to deliver a unified view to our citizen, to kind of give them a no wrong door access to a lot of these services. And there's no doubt that mobile is going to play a tremendous role in the next 5 years in terms of where we're going with the delivery of services in a mobile environment. We've done a lot of work in this area, and if you look at the smartphone growth, you look at the tremendous growth in services delivered to both the smartphone platforms and the tablet platforms, it's going to increase dramatically. And some of the experts are looking at a 50% increase in the next year just in smartphone delivery. And it's already worldwide over at 550-some million. So I think that we're going to see some tremendous growth. Along with our strategic priorities, if you look at your next slide, you'll see our priority technologies, applications, and tools. And again, I'd point out that a top 10 list, heavily weighted with virtualization and the top 3 getting a lot of attention. But identity and access management, I think for the 7th straight year, is in our top 10. That's something that deserves a lot more attention that it is receiving from the states, but we know what a challenge that is, and that's one of the driving factors behind NASCIO forming our digital identity working group, is that this is an area that has not received kind of implementation and execution at the state level that it probably deserves, but we know how problematic that is. So again, you see the intersection between the top 10 and the strategies and the top 10 and the technologies. As we dive a little bit deeper into the digital identity activity and the work of our digital identity working group, again, you can see that we look at the dependency that is directly related to identity and credential management and access management within the states. And we believe this, again, the strategic framework really needs to be preached by the state CIO on the enterprise view, and hope that there's a framework that's in place. And this is tied directly into the major topic on the next slide around states and the healthcare. And again, the tremendous demands that are being placed upon the states with the Affordable Care Act. There's certainly state resources that are available, federal resources that are available to the states, and the states, have definitive deadlines to respond. But again, as we've outlined in a lot of our work already and guidance and recommendations to the state, this is going to be about a lot of collaboration. It's going to be overcoming some of the legal and regulatory and administrative, the structural barriers that are already in place that need to be addressed and remediated. There's significant concerns around data architecture and data management. Again, we're talking about the massive data sets. We're talking about a policy and program area that is one of the most complex that state governments have to deal with. And certainly with the requirements around health insurance and health benefit exchanges, one of the, I guess, as people have said, the 500-pound gorilla is Medicaid. States are now expending an average of 22% of their state budgets for Medicaid. They're under the gun for Medicaid expansion. The states are going to have to make tough decisions around their Medicaid programs. And one of the areas that has been received a lot of attention and discussion is around improper payments fraud control, and abuse. And identity management is one of the potential solution targets for that kind of cost control in the Medicaid space. So again, we'll hear a little bit more today about interest in identity and access management around Medicaid, both on the internal and the external side. So I guess to wrap up, again, some thoughts about why identity management and health IT really is a top priority is that, again, we're talking about interoperability, and interoperability across multiple jurisdictions, federal to state, state to local. The states are the administrative arm, the execution arm for the federal government in many of these programs involving health IT and eligibility to citizens. And again, our argument at the NASCIO side is that we need to promote an enterprise approach to identity management, and the health area and healthcare delivery system is an ideal place to look at that. And we really need to focus on an interoperable trust framework across the states, and also based on standards. So that's really important. And again, I think we're going to hear more about that from our two state presentations today. We believe that we need to look at, again, a single type of platform, or a single type of platform that supports multiple uses. And again, our focus has been primarily on digital identity credentials and digital identity issuance, but there's obviously level 1 through level 4 types of products that we can talk about it in more depth later. But again, this requires a significant amount of interoperability between jurisdictions, and also the things like identity proofing, and the business process is very important in this. And so we believe it's not only around the technology, but also reforming the business process in the states and enabling a standards-based provisioning of that access management, and again, subsequent auditing and inspection of the process itself. So the overall business problem, I think that many of you on the webinar today understand, is that the states are the nucleus, they're the nexus of identity for individuals from cradle to grave. It's important that the states do take the lead on that. We also know that we have many identity silos within state programs, both internally and externally, and those credentials are difficult to manage. They come in multiple form factors, and attributes are all over the place and very difficult to corral. And so we do need to create an overarching framework for that. We understand certainly very well that there's major technical and operational policy issues. There's a whole host of legal issues, particularly around privacy, individuals concerned about privacy. So we have to address all of those under a national framework with a trusted federated identity model, and one which can be used. Now, there's certainly the technology and the standards in place. They're in some cases a little more difficult and costly to execute than we would like, but there's certainly an approach that can be used, and we're urging obviously states to look at the existing standards that have been developed at the federal level, and try to look at how they can be used at the state level. So what to watch for ahead is again, this discussion around a building an identity ecosystem, and I think that's going to take collaboration among the states and federal governments. We need to establish, again, that chain of trust, particularly with digital credentials. There are significant resources available at the federal level, but they're also undergoing the same types of fiscal constraints that we have now at the state government level. And we believe that perhaps in the healthcare arena, there are tremendous opportunities to promote this interoperable identity management solution. And I guess we're looking to the states to do that within a standards-based environment. And we think that's very, very important, that it must be built on non-proprietary, interoperable product sets and solutions. And I think the federal government certainly has built a strong foundation and baseline around that. We can leverage that and leverage the work that's been taking place, and also the fact that we now have over 250 solution providers that also work in that area. So again, I think there's a lot to look for going ahead, and that just provides you kind of the foundational work and some of the challenges that the states are facing today. But in spite of that, we do have states that are moving forward and looking at the opportunities, and I think it's very important that they look at opportunities in the health services area and healthcare management and the areas of Medicaid, because we know those are major programs, if not the major program in the state, and where the federal government has a significant footprint because they rely on the states to administer those programs on behalf of the federal government. So with that kind of background and foundation, I'm going to turn it back over to Chad for introductions from our folks from Minnesota.
Great. Thank you, Doug. That was a wonderful overview. Moving into this next segment, we're going to take a look at what the state of Minnesota is doing. I'd like to introduce Thomas Baden, who's the CIO of Minnesota Department of Human Services, and then also John Paulson, who's the CIO of Minnesota Department of Health. At this time, I'd like to hand over to Minnesota.
Thanks, Chad. This is John Paulson. I guess I'll start off. We wanted to, preface our remarks by saying that, this fits right into the previous presentation. We're sort of moving down a path that's anticipating a national framework will be in place, and sort of anticipating that, but knowing that there's a lot that we can do while we work towards that national framework. So that's kind of the background for where we're at. And so what we're really trying to do here in this presentation today is talk just a little bit about the problem that we're trying to solve as sort of a tactical approach to getting ready for that framework, sort of the benefits of that solution, the barriers to implementation, and some of that will be a little bit repetitive because we all know that the barriers are the same barriers, and then talk a little bit about what our strategy actually is for identity in health IT. So next slide, please. This slide is what I call a simplified view of the current complexity. And so I'll go through it very briefly because I think many people are familiar, but not everyone. If you sort of look at the different bubbles there, we have the beacon communities, and those beacon communities need to share health information, and they have their own identity and access management systems. We have the health information service providers. So I'm going around clockwise here. We have agencies like corrections, human services, which Tom will be talking about, Department of Health, where I'm at. We have the insurance exchange and the health exchange. And then those need to talk to federal hubs and to other states. And I call this a simplified view because this is a complexity diagram showing that right now we each are sort of managing our own identity and access management in each one of those spaces. And yet some of those bubbles represent multiple organizations. And each one of those organizations has a complexity diagram similar to this behind it. So you really get in a hurry to where there are hundreds and hundreds of identity and access management systems at operations, or at sort of operating in the healthcare space right now. So that's really the problem that we have, is we have too many inconsistent identities, and we're seeing a lot of issues with that. So I'm going to speak to some of the business side of that, and then let Tom follow up with a little bit of the architecture side. So next slide, please. So, this is sort of repeating a little bit, but we did want to make sure that even just within Minnesota, these are the efficiencies that we could see, or the benefits that we can see to a consolidated or an access management strategy in health IT. Certainly, a lot fewer of those point-to-point identities. If we could move to a more hub-and-spoke kind of an operation, we wouldn't need hundreds and hundreds of those point-to-point trust operations happening. And of course, most everybody realizes that even though that's technically difficult, there's also the policy issues and the practical matters of putting data use agreements in that satisfy all the legal and privacy issues. And so that's a lot of data use agreements to create and manage. And of course, the main driver of efficiency here is we see that we're spending a lot of resources doing identity and access management in all these different places, and and yet we're stretched thin, so we're not really probably doing as good a job as we could on each one of those. So if we were to go to a more hub and spoke where we had a centralized kind of identity or a federated identity, we could do a much better system, a much more robust system with less total resource, but certainly more on any one given identity system. So we really are looking for that response to the cost and efficiency pressures that all CIOs are facing, and both Tom and I are very sensitive to that. it's been mentioned already, privacy is a continuing focus. More and more focused resources around standard trusted processes and systems will actually improve our privacy and security profile. Minnesota has laws in place, for example, that are very strict about privacy, and we certainly support those and respect those. Everybody has the right to privacy, and we're doing everything we can to respect that privacy and make sure that we focus on that. But for example, we are not allowed as the Department of Health to access the record locator service in the Health Information Exchange. That's a particular law here, and we need to find a way to make sure that we can still trade identities in a trusted fashion and still satisfy all those privacy concerns. And then certainly improved health outcomes. We think that a distant identity consistency will lead to fewer errors, and we'll have more health resources on health versus just on identity. And that's also a good thing from an IT perspective. So we really see that identity, while it does certainly speak to security and it very strongly speaks to privacy, it also speaks to quality in the healthcare field. And I know that NASCIO has recently created a report for state CIOs talking about the health record exchange errors and the number of incidents related to identity. So next slide. So we're facing similar barriers to the ones that were already outlined, and I would be surprised if any states say they don't have these issues, but funding continues to be a barrier. We all have budget pressures in general. Nobody has as much money as we used to. We're always being asked to reduce our budgets. And then, of course, one of the other problems we have is just sort of the structure of funding. The Minnesota Department of Health is got a significant portion of its funding is federal and grant and sort of silo-based because the structure of the funding is based towards a particular area or a particular program and not enterprise-based. And so it's more difficult for us to sort of spread that money around to do more enterprise-type things. Not impossible, and certainly everybody's willing to do that, but it takes a lot of planning up front. We have organizational issues because the divisions are all focused on providing the best possible service, and identity management is not always seen as a strategic to that particular service or organization. And then, of course, I don't want to beat this dead horse, but the privacy and data practices issues are significant. They are not to be underestimated. They are, we have to address them for all the constituents. And, there's not going to be a citizen ID. I mean, we really don't see a citizen ID as a solution for this because it's just not a possibility in many ways. And given that, we are always going to have some difficulty in creating links and making sure the quality of our identities is high. And it's not insurmountable, but it adds a wrinkle. So, next slide, please. And then I put this slide in because I really wanted to emphasize that we are very, very conscious that identity has a larger scope than just privacy, security, and authorization. When there is no ID and you're federating identities, we always have this false positive and false negative trade-off in matching people up. And if you become too conservative and too nervous, and you can end up very easily with errors of omission, saying I didn't give you the information that I had because I was worried it wasn't 100%. And if you get too liberal in your matching and linking of information based on identity, you can certainly go the other way where you're starting to give people the wrong information. So I just put that in here to really highlight the fact that we really see the identity as really focused on quality as well as security and privacy. Okay, the next slide, please. And I think at this point I want to turn it over to Tom, if you will, Tom.
Thank you, John. John and we have a really interesting relationship in that the Department of Health and Human Services are two separate agencies. Medicaid is in Human Services, but we're two agencies, and John and I are really, really joined at the hip. So I'm really enjoying doing this presentation with John. This perspective comes a little bit more from the Medicaid cash and food perspective, but also ties with Department of Health and all of their activities, as John pointed out earlier. Right now, we've got a number of web-based applications, particularly if if you look at Medicaid, for example, there's a whole diverse set of actors. Certainly, providers are one of our key people with Medicaid that we deal with now, and there's practical implications just simply to providers in that. Right now in Minnesota, we've got about 100,000 providers that upload data, primarily for claims processing, eligibility transactions, your basic HIPAA transactions that are done in the Medicaid space. One of the complicating factors, even just within providers, as we've rolled out web-based identity management, is that clearinghouses, for example, have people that work for multiple providers. So how do you design your directory for a person that works for multiple providers, and you've got a HIPAA agreement with one provider, but the person works for multiple providers? So there's practical implications there. The other piece of the puzzle is that we've got state and county staff, some that work within a contractual basis, and obviously state employees. But now this whole new shift to becoming a person-centric operation, and Medicaid in the past has not really looked at itself so much from that perspective, and that's really beginning to change. As we move into the health insurance exchange and people start procuring, for lack of a better term, or becoming eligible for Medicaid-type programs, they want to start looking at their own data, capitation data, and they also want to look at provider performance and things along those lines. So we're shifting from being a total provider-centric to also now a person-centric approach. And that's where now, as we move into our application portfolio and we look at everything that we've got across the spectrum of the portfolio in health and human services, we've got integration points with legacy systems that are 20, 25 years old and modern service-oriented architectures, so that our ability to be able to do these types of large transaction sets and have people authenticate and authorized to use these different systems is really very, very complicated on the integration front. And as you're moving into building front-end protection, your keys to the kingdom with your authentication and authorization services, don't underestimate that work. The integration pieces are really, really substantial. The other things that we're finding already is we at the DHS put in an authentication and authorization tool set, and we're moving all of that over to the state platform. And what we're noticing is that as the authentication and authorization softwares go through its standard life cycles, the integration points with all of those different varying infrastructures behind it, whether they be legacy information like ACF2 or Active Directory, or even connecting to LDAP, securing different web services. As those life cycles change over, you've got to orchestrate the life cycle of the upgrade of those applications very, very carefully. That's been one big challenge for us. Another one is on the directory design and architecture. And at this point, when we look at just within what's happening at Human Services, we've got about 40 applications that are all protected. And a number of them are all directed by different federal and state regulation, and they have different rules around them, and those all have to be factored into the design. And there's different ways we can architect the directory services, whether they be an LDAP or whether they be an Active Directory or connections to ACF2 or, whatever those pieces are. But one of the big challenges for us is, because of those real specific rules, how do we assure that the authentication and authorization utilities are meeting the legal requirements? So that design architecture is very, very difficult. One of the other big pieces that we've got is, for example, in Medicaid, we've got 5 layers of delegated administration. Some of the tool sets out there do it very well. Some of them are a challenge. It's another pretty difficult piece. The other real important piece to make sure you're considering and factoring in your planning is the compliance and reactive controls, especially once we're moving to a much more shared service-oriented architecture. The health insurance exchange is a perfect example. It's going to touch, systems that, it's going to touch the federal hub. It's going to touch systems and multiple state agencies, all directed and controlled by, in many cases, different rule sets. And to be able to build in all of the compliance controls to know who's looking at what, when, why, and how is a real important piece of the puzzle. And as you're entering into this space, every time we go into some sort of technology project, we always look at the entry, but also what happens if we want to change vendors or change components. And Chris Boozy here in Minnesota has done a really, really nice job of establishing a governance structure, which I think is going to be essential to its success. The architecture, the pieces of hardware and software installed are I think, the less difficult pieces. The directory design and the integration to softwares are where that's the part of the iceberg that's below the water that you can't see, that ends up being a tremendous amount of work. Don't underestimate that piece of the effort contribution, and determining exactly how deep you want your authentication software to be integrated with your software and infrastructure components. Many of those COTS products have got a lot of those controls already built in, so integrating into those becomes more complex. So it's a challenge just to be aware of. The implementation pieces, like all hardware software implementations, definitely factor in not only your overall implementation costs, including the integration, the architecture, hardware, software, integration with your tool sets, but also the total cost of ownership ongoing. These projects they don't just tip up and stand up and stay up. They require quite a bit of care and feeding. And we on the exitability piece, we went into it from the standpoint of we want to protect the surface and do less integration. A lot of the software products, you can integrate the authentication and authorization down to control buttons and data elements and things along those lines. The farther you tie that authentication software into your application, the tougher it is to exit. Next, please. Long term, the real key for us, for John and I, and our big challenge here in Minnesota is it's healthcare, but it's all of human services. And to keep it simple, flexible, efficient, responsive is really important, because we tie together not only the insurance exchange and people being able to get insurance, but also being able to tie into Medicaid programs, the Department of Health programs. And very important from our perspective is that we want points of eligibility so that we can coordinate activities across programs, so that as people come out of, for example, chemical dependency programs, they've got a roof over their head when they get out, so they don't end up back on the street and end up back in the program costing us more and more and more. So coordinating eligibility to all of our programs and managing all of our programs across health and human services and being fully integrated requires very, very robust authentication and authorization services. And has been pointed out time and time again, when we look at the overall costs of our healthcare programs and even costs of our regular programs, it really is turned into all about outcomes. And those outcomes are better served by applying all of the components that we have within government that provide effective service over the long run. Next slide, please, and I'll pass back to John.
Thanks, Tom. I see we're running close on time, so I'll try and go quickly here for the last couple slides. But what we're really showing here is the optimistic view of what could be done with part of a broader state IAM framework. And so this isn't really so much a strategy, although that's what I call it. It's more of a vision. This is where Tom and I are trying to go, and we'll take some steps along that path, along with the help of the Office of Enterprise Technology and the people over there like Chris Boozy that he's mentioned that are working on providing these services for us. And so the idea is, if we didn't get all the way to this vision, but we got part way, that would still be a huge win. And so we just look at it and say we could do this. This is the optimistic view, and both Tom and I are optimists, so we're trying. Next slide, please. And so just to wrap up, I wanted to share with you what we're actually doing to step on down that vision, which is OET has purchased and implemented a state IAM system with a production target date of 2011. Now, I'll be first to admit that's probably going to be a level 1 framework, but both Health and Department of Human Services are charter members of that committee. We're looking at how we can start piloting some of those things. We already have an operational strategy for our funding, and that's already in place. So we've done some of the big work already has been facilitated for us by OET and the state IAM, and that's part of just a broader security framework. And then organizationally, MDH and DHS are both targeting pilot systems and are discussing shared identity systems and next steps. And so the privacy and data practices discussions are just beginning, but we think we're in a good place to have those discussions. So with that, I'll stop and say thanks very much and turn it back to Chad.
Thank you, Tom and John. We appreciate your overview. That was great. We're going to, because we're low on time, quickly move into Virginia's example. At this time, I'd like to introduce David Mix, who's the Health IT MITA Program Manager at Virginia Department of Medical Assistance Services, and also Mike Farnsworth at the Commonwealth Authentication Service Project Manager at the Virginia Department of Motor Vehicles. At this time, I'd like to hand over to Virginia.
Thank you for this opportunity to talk about what we're doing. If I could have the slide up, please. Okay, so we've already talked about some of these business drivers in the Recovery Act and Affordable Care Act. For Virginia, we're looking at about a 40% increase in our members when Medicaid expands. That translates into roughly $40 million in increased operational expenses. That's our basic cost avoidance business case for what we're doing. And we're also looking to increase the efficiency or accuracy of our eligibility, which some of our audits, we got a 16% error rate in there. So a lot of what we're targeting to do is addressing current problems as well as looking to meet all the federal mandates. Next slide, please. So our strategy is to leverage basically the MITA framework as our core strategy to address both the Recovery Act and Affordable Care Act requirements, adopt the MITA vision for self-directed services. Those services would be something that a customer could go onto a portal and process through without any worker intervention. We wanted to look at our requirements from an enterprise perspective, so we currently have 4 agencies from 4 secretariats working in a partnership with us on this. We used our state self-assessment process to align our efforts to the federal direction, and that in turn helps out on the federal funding assistance. We're setting up a secretariat-level program office to coordinate it, and we're also looking to leverage the existing assets. So collaborating with identity management efforts with DMV, the Health Information Exchange, and state agencies. The Virginia IT agency provides our enterprise infrastructure. So that's being adapted where necessary for the new technology that we're putting in place, which is a service-oriented architecture. We're also doing strategic planning at the secretariat level, and that's aligning our state agencies to begin to reflect the migration path to an enterprise level of interoperability. And our legacy systems will be able to interoperate on the enterprise using standards-based services and interfaces. And we're getting alignment on our standards through our VITA. And all of this is going to become an enabler for the business transformation that would take place. Next slide. And I would like to turn this over to Mike at this point to talk about some of the details of our identity management.
Thanks, Dave. You know, it's interesting. I'm sitting here with some of the fellow panel members, and sometimes I feel like the odd man out. People often ask me, so, hey, Mike, you know, you're with the Department of Motor Vehicles. How'd you end up in working on, you know, health IT initiatives? And I think if you step back and take a look at the role the DMV has taken over the years, what used to be a permit to drive, a state driver's license, has kind of taken on a little physical token of identity document. So it's kind of interesting how identity management has started to grow and evolve, and then how these ties. And I kind of share the same sentiments as our previous panelists. I find it very interesting to work with some of the health IT community, and I'll kind of talk a little bit about some of the things we're doing. I'm going to kind of take a little bit more tactical approach and look at some of the things that we're actually wrestling with. I think it's safe to say we've heard a lot of resonance with the fact that, authentication improvements are necessary. Anytime you have multiple agencies trying to work together for a common vision, funding streams are different, budget cycles are, money and how it's allocated to different agencies is different. And so you can imagine that some of the processes for authenticating individuals for government services can kind of get fragmented over time. People talk about modernization, but this also tends to lend itself to benefits fraud and problems with some of the traceability of where the money flows. Also, if you think about the government transactions that have been put online, a lot of government services are indeed available online. However, there's still an increased dependence on face-to-face transactions. And a lot of those are really just rely on the fact that, you really need to be able to prove that Mike Farnsworth is Mike Farnsworth, or that the person sitting in front of you is definitely entitled to these benefit programs. So these fragmented authentication systems will essentially worsen over time as more and more transactions and more money start getting pushed online. We have an aging workforce as well here in Virginia. We have a very significant number of our staff that are eligible for retirement. We also know that benefits, given budget situation and the job market, government resources are starting to become scarce, and population seeking benefits grow. One of the interesting twists on this is that, there's been some successes in private center authentication that just typically haven't been seen in the government space, and we know that it results in lower administrative costs, theft and fraud is actually decreased, and then we're actually able to provide better and cheaper service to the customers. So it's safe to say that by not starting to adopt and utilize some of this more modern technology can result in losses. The actual business processes that support a lot of these things, one of the things that we've been kind of looking at is how do you surgically insert authentication at the outset. And by doing this, once you authenticate somebody correctly and you really know who they are at the outset, then a lot of the remaining processes will continue to work, which means that, hopefully you can start to achieve greater results over time simply by getting it right the first time and not having to do it rework. Next slide. I think one of the key things to point out here is that, I'll use DMV as an example. I mean, we're a state entity. We maintain an enormous amount of information around identities, but we're not the only ones. There are multiple identity providers in the market space. They're both public and private. We have federal and state parties to this that have information around identity and identity attributes. Think about those that are serving things like the health information exchanges and health benefit exchanges across the country now. You have a lot of your physicians and your providers. And then you also have your actual citizen population, those that are actually receiving benefits. So it's important to take a multifaceted approach to the implementation and identification of the different identity providers. I think another thing to point out is that there really is a number of relying parties downstream from the identities that need to be taken into account so that their needs are actually addressed. Private sector wants to always rely on state-issued credentials. So when you start thinking about that, equating that back to the physical world, whenever you go to use your credit card someplace, they're saying, "Can I see your ID?" And I always thought, wouldn't it be interesting if I were to actually produce like a self-asserted identity, like a business card, and say, "Well, here's my identification," to see what kind of reaction I would get. But they're looking for a common interoperable type of identity credential to move forward. I think as we heard earlier, ties to the other bridges, success is in the numbers. As more and more people start to do business online, as more identity credentials are issued, the key is that they're based on standards-based implementation. This encourages adoption. It makes sure that when you do need to handle the interoperability and bubble up under another umbrella, that you're not kind of flying in the wind and doing something that really is not very compatible. I'll talk a little bit about on the next step about adoption, but people look at identity providers and the relationships, and you start getting into the technical side of how the attributes are produced and how they're validated. It can be very overwhelming and very complex. So the importance of having some standards-based implementation actually helps narrow the gap from the simple to complex. Next slide. I think one of the things that people always come up with, and they always ask us, okay, it sounds like a great idea, but what do we do now? And I think one of the things that is important to point out is that identity and access management is already prevalent in a lot of the industries. And we look at aerospace and defense; they have a very rigorous and robust infrastructure. So why not learn some of the some of the lessons that have already been traveled, and then actually bring it into the government sector to support some of the initiatives. Talking about health IT, and I think this is one of the points of this webinar, is that when you start looking at the alignment of health IT and identity and access management, health IT serves as an avenue for implementation. I know that from our perspective here, our efforts and the efforts that I'm kind of working through are really driven by Virginia's strategy for the HIT MITA initiative. It's also driven by some of our technology modernization efforts, and then some of the executive orders that are driving. So it allows us to enjoy some of the benefits of high-level sponsorship, some of the stakeholders, getting them involved early and out of the gate. And I think that's really important to address the third bullet. Whenever you talk to a lot of the agencies and folks that are saying, okay, so we're looking at a Commonwealth-wide and enterprise way of actually authenticating individuals, it's always reassuring to know that the folks above are actually behind it and endorse it, and it also helps address some of the privacy issues and the concerns, because it allows you to bubble these issues up so that they can be addressed early out of the gate, rather than lingering for a long time. Another question that people always come up to, they talk about, okay, well, this is going to be real difficult for us to do. And that's one of the important things of why we're looking at taking it, in a multi-phase approach. We're looking to do it once and do it right, and then actually make it repeatable with templates and pilots and roadmaps, so that it's easier to onboard people to using, a Commonwealth or an enterprise-wide ID management solution. And then, of course, it's always the big question is, well, is it worth it in the long run? Well, I think you can, tell just by, the amount of money that's flowing through the Medicare and Medicaid system, and addressing, the audits that have been in place. there's some very significant numbers resulting in not being able to actually prove somebody's identity. Next slide. So I guess, to kind of give everyone a sense of where we are, I think one of the key things here is that, this is a Commonwealth-wide initiative. We have involvement from not only DMV, but I think like Dave alluded to previously, we have our Virginia Information Technologies Agency. They're responsible for all of our infrastructure and have been a strong force in getting stakeholder engagement. We have the Department of Social Services, Department of Medical Assistance Services. We have the Department of Health Professions involved. They're the ones championing our health information exchange. We also have, they're our provider directory, and we have the Department of Health is championing our health information exchange. I think we've kind of talked, we're using health IT as the primary driver. Our initial tackling of putting in the ID management is really targeted at the health information exchange around providers and organizations, but then also looking at the citizen side of the house for some of the benefits programs administered by the Department of Social Services. We talk about DMV's involvement here. One of the things that people are always interested in at DMV is the fact that, in order to get your driver's license, you got to come in and prove who you are. So the in-person proofing aspect of it for helping to increase the assurance level and the identity is key to the success of this initiative. We are taking a multi-phase approach. Like I say, rather than trying to tackle the whole big monster all at once, we're looking at these two primary areas to implement the ID management side of the house and provide that authentication level. And then, we'll start to align that with future initiatives. I believe that's it for me, Chad.
Great, thank you. At this time, I'd like to thank all of the panelists for their wonderful overviews and giving a state's perspective. Very insightful, and getting that overview in the beginning was very helpful. At this time, I guess we can move into a Q&A type of session. If our panelists could stay on, we do have two questions that have came in. I'll start with the first one and then move into the second, and we can just have any of our panelists chime in as they see fit. First question. The discussion of citizen ID has been knocked around for years. We have one with a social security number and one at a state level with a driver's license. What are some of the barriers to adopting one of these as a citizen's ID along with two-factor authentication? Would anybody like to take that question or field that question? Well, I think it's an issue that obviously has been bounced around quite a bit. There are some political things that come along with that. I guess we'll try to respond to that possibly as a follow-up, or we can get back to you at least offline in regards to that question. But we can move into our second question. This comes from Wesley Crummell. I did not hear FICAM, SciCam mentioned today. When looking at your Identity Access and Credential Initiative, how do you view FICAM or SciCam, its adoption, directives, and standards and framework as part of the work you are doing? Any of our panelists?
This is Tom Baden here from Minnesota. We definitely are using those as context for our planning in both cases. I was real fortunate here about a year back down in Florida to attend some of those meetings out at NASCIO on one of those Sunday afternoons when I didn't enjoy the beach and was actually in watching some of those presentations. And our state CISO, Chris Boozy, has been using those as kind of like our guiding planning documents as we move into doing our work here. So those are important pieces of work.
Yeah, and I think this is Mike, I would actually concur with that. We've actually been using those as a basis to build on for our use cases and a framework. And this kind of goes into the interoperability conversation. One of the important things is that if you can align to, initiatives that are, mainstream and have traction, it kind of helps adoption along, and it also help speed the pace up a little bit.
Great, thank you. We are approximately at 4 o'clock, so one last question, and this is the last one one of the last ones we received. Do any of the panelists have any return on investment information they can share with the audience? Has there been any results you've been able to share?
This is Tom Baden from Minnesota. I don't have any of the numbers in front of me, but some of the cost-benefit justification we were looking at the very beginning were just simple things like the number of LDAP licenses and Active Directory licenses we were paying for across the state. And we had tens of millions, and there's only between 5 and 6 million people in the state. And so we were buying identities over and over and over and over and over again. And even now I look at it from our perspective, and I've got hardware that's end of life, software that's end of life, and would have to reprocure all that stuff all over again. But instead of doing that, let's put that toward the pool so that the state can use that infrastructure to carry it forward. So it's a combination of, just if you look at it from the pure cost benefit of the infrastructure and the cost of licensing, it makes a business case really, really quickly, and that doesn't even include the real practical business implications of controlling the identities and the fraud and abuse pieces, and all of those components, and ultimately the ease of use of the people that are consuming government services. But I don't have any actual numbers for you in front of me here today.
Great, thank you, Tom. Well, it is 4 o'clock. I want to thank all of our panelists today for all the work they've done. I do want to let all of the attendees know that these slides will be available. We plan to post a archived webcast of this. It may take a little time to get up on our website, but we do plan to do it. If you need those slides immediately, or you need them for some reason, just feel free to shoot me an email at cgrant@amrms.com, and I can try to get those to you as soon as possible. But I want to thank everybody for joining today. A great round of applause for our panelists. They did a wonderful job. Thank you, and I hope to have folks on some NASCIO webinars in the future. Thank you, everybody.